So the first of these, and probably the most obvious, is we're going to see a decreased blood pressure. And again, we'll talk about some of the causes and the reasons for this, but there can be multiple things that are going on, but the end result is a low blood pressure. Typically, you're going to find yourself in a state where you have an increased heart rate, but there is one form of shock that we will talk about later that this doesn't happen in, so it's important to know that this is not always going to be seen, but usually will be. You're going to have a weak and thready pulse. So you're going to have rapid breathing and increased respiratory rate, and it's also going to be shallow. You may also notice pallor in your patient. You may have either absent or decreased bowel sounds. And a couple signs that we would see when we're looking at end organ damage. And a couple things that you would see when you reach this point would be confusion and lethargy. Another sign would be a reduced or absent urine output. Also, you would see cold, clammy, mottled skin. Another sign that you would see indicating end organ damage would be ST elevation. Now, these are not obviously all of the signs that you would see in shock and end organ damage, but these are some of the major ones that you really should be on the lookout for. And finally, I just want to talk about some of the lab values that you can expect to see. The first of these that you'll see is an elevated lactate. And this is going to be a direct result of that switch from aerobic respiration to anaerobic. You're going to see a decreased pH, also what we call acidosis. And this is specifically going to be a metabolic acidosis. You'll see an elevated BUN and creatinine. You'll also see an elevated ALT and AST, indicating shock liver. You'll see elevated troponin. Also a decreased PaO2, and this is a result of the decreased perfusion leading to less oxygen making its way into the blood. And finally, one of the things that you'll see is an altered SVO2, and depending which shock you're in, this can either be elevated or decreased, and again we'll talk about that